When life gives you 100 reasons to break down and cry, show life that you have 1,000,000 reasons to smile and laugh. Stay strong. Hi friends, welcome to my channel Physio Notes. So today we are going to discussing about a new topic which is called as tennis elbow or otherwise called as lateral epicondylitis. So what do you mean by a tennis elbow? So tennis elbow, it is defined as a pathological condition of the wrist extensor muscle at their origin, that is mainly on the lateral humeral epicondyle, which means there is an inflammation to the common extensor origin. So what is the main reason for this? It is due to a repetitive movement or it is an overuse injury, so that will leads to some micro tear in the lateral epicondyle and that will causes some inflammation. So this is lateral epicondylitis or otherwise it is known as tennis elbow. So this is the picture which showing some this is a picture that is mainly showing the anatomy of the elbow. So in this picture we can clearly see that here there is a biceps, there is a extensor muscles, then there is a extensor, common extensor origin, and in the tennis elbow case there will be in this area there will be some painful area. Okay, that I think that you can see that there is a common extensor area is the area of pain and inflammation. Okay, then we are moving to the next slide. So what is the mechanism of injury of this condition? So any household activity or any repetitive movements that is in the sports field also, that will causes some repetitive stress on the structure and that will leads to micro trauma. So if you are not treating this micro trauma properly, that will leads to micro rupture and that will causes inflammation and pain. So this is the main mechanism of injury. Epidemiology, it is most commonly seen in 30 to 35 years of age, 30 to 55 years of age, and this term, actually this term indicates tennis elbow, but it is not commonly seen in non-tennis players. Okay, that is mainly in the housewives or common people, and only 50% of people partaking in sports with overhead arm motions will develop this condition. So etiology, it is I already tell that it is due to an overuse and muscle strain injury, and the cause is repeated contraction of the forearm musculature. So most common cause of this tennis elbow in tennis player is repeated use of backhand stroke with poor technique. So what will happen, that will causes some excessive force on the extensor word and that will result in this condition. And there are other contributing factors which include grip size, string tension, poor racket dampening, weak musculature of shoulder, elbow and arm. These all factors also contribute to this condition. However, many other common arm motions can also lead to this condition, like using a plumbing tools, painting, lifting heavy luggages or tightly gripping a heavy briefcase, driving screws, cutting up of the vegetables, then repetitive computer mouse movements, etc. So that also can cause this tennis elbow condition. So what is the most important clinical feature is there will be a recurrent pain on the outside of the upper forearm just below the bend of elbow. So there will be point tenderness in the lateral epicondylitis and gripping movement will be painful. Then there will be pain is aggravated or exacerbated by wrist extension against resistance and elbow extension is mildly limited. Then there is sometimes swelling we can see. Then differential diagnosis, especially differential diagnosis are C6 or C7 radiculopathy, then radial tunnel syndrome, then distal biceps tendon regeneration, then degeneration, then posterolateral instability, capsular infolding, radiocapitular arthritis, etc. Then what is the main investigatory methods that we can do in this condition is X-ray does not reveal any abnormality and we have to go for the physical examination. So physical examination, by physical examination only, by palpating the lateral epicondyle, we can see that a point tenderness, it is a classic feature, and also there is some swelling in that and there is some limitation of the elbow extension or elbow movements, and the while doing this wrist movement there will be pain in the elbow. Then Doppler USG. And next one is special tests. What are the special tests that we have to do for this condition? So mainly first test is Cosen's test. Cosen's test means what? The patient elbow is stabilized by the examiner thumb which is rest on the lateral epicondyle, and the patient is asked to actively make a fist, pronate the forearm and radially deviate and extend the wrist while the examiner resists the motion. So sudden severe pain in the area of that in that particular area is shows that the test is positive. So we can say that here what happened is the patient here that in this two pictures we can say that the patient elbow is stabilized by the examiner's thumb on the lateral epicondyle of the humerus and ask the patient to what just make a fist, then pronate the forearm, then radially deviates and extend the wrist. While extending the wrist, the therapist have to apply what a resistance. So if there is any pain in the lateral epicondyle, the test is positive. Then second one, it is Mills test. Mills test means while palpating the lateral epicondyle, examiner passively pronates the patient forearm, then flexes the wrist fully and extends the elbow. So pain over the lateral epicondyle shows the test is positive, and if the maneuver is also put some stress on the radial nerve also. So if there is any presence of compression of radial nerve also, this test is positive. So we can see in this picture. Okay. Then next test is Maudsley test. Maudsley test means the examiner stresses the extension of the third digit just distal to the PIP, proximal IP joint, and that a positive test is indicated by the pain over the lateral epicondyle. So these are the three special tests that is mainly used to differentiate the tennis elbow from the other condition, that is mainly Cosen's, Mills and Maudsley test. Then management. So we are going for the management. So first one is non-surgical management. That is approximately 80 to 90% of patients have a successful non-surgical treatment. That is first one, it starts with Price protocol. So here the P stands for protection, then R stands for rest, I stands for ice, then C stands for compression and E stands for elevation. Then NSAID is mainly drugs like aspirin and ibuprofen are given. Then physical therapy techniques. Again brace that we are giving here counter force brace. So this part it can be also included in the physiotherapeutic part. Okay, so in this picture that you can clearly say that what is the differences between with the brace or without a brace. So in the first picture that there will be some irritation over the lateral epicondyle due to the pull of the extensor muscle over time. So by wearing this counterforce brace, that will compresses the extensor muscle and that will remove the tension by preventing the pulling of muscles on the lateral epicondyle. So this is the main use of this brace. Okay, so that will reduces the symptoms by resting the muscles and tendons. Then next we have to go for steroid injection such as cortisone. Then activity modification, that is we have to eliminate which activity that causing the pain. Okay, that is repetitive pronation supination motions and lifting heavy weight that should be eliminated or modified, and lifting that can be done with palms up, that is on the supination whenever possible, and both upper extremities should be used in a manner that reduce forcible elbow extension and supination and wrist extension. Then correction of mechanics, that is if a late or poor backhand is the cause, that will it's a cause we have to correct the mechanism of the stroke. Then if you are typing in an unsupported arm, that will exacerbate the pain. So we have to place the elbow on a stacked towel. Stacked towel means a towel is placed one after the above. So that will helps to reduces the pain. Then we are going for the surgical management. So surgical management is done if the symptoms is not respond to the non-surgical method after 6 or 12 months or more, we will recommend for surgery. So either it should be openly or arthroscopically managed. So here what happened is we are removing the diseased muscle and reattaching the healthy muscle back to the bone. So this is the picture which showing the arthroscopic repair of the elbow for tennis elbow condition. Okay, here using a surgical instrument. Then physiotherapeutic management. So physiotherapeutic management, again we have to start with conservative management, that starts with cryotherapy, that is ice pack for 30 minutes and ice massage for 7 minutes over the painful area for 4 to 6 times per day. Then supportive measures, that is we have to wear some splint. Then next is ultrasound and TENS, that is mainly used to controlling the pain and inflammation. Then electrical stimulation, it helps to relieve some amount of muscle spasm and also prevent the formation of adhesion and reduces the edema. Then gentle effleurage and kneading during first 2 weeks. Then stretching exercise, range of motion exercise, strengthening exercise. Strengthening exercise, here a gentle strengthening program should be planned. That is, we have to mainly improve the grip strength, and also we have to improve the strength of wrist extensors, wrist flexors, biceps, triceps and rotator cuff. So what are the main exercise program include in the strengthening program is, that is the active motion and submaximal isometrics, then isotonic eccentric hand exercise with graduated weight but not exceed 5 pounds. Then wrist curls. Wrist curls should be done for 10 times with 1 to 2 pound weight, and we have to increase to 2 sets of 10 daily, and then increase the weight by 1 pound, okay, for up to 5 to 6 pound. Then forearm strengthening, then elbow flexion and extension exercise, and we have to do using a racket ball. It mainly helps to improve the grip strength. Then we have to progress this strength, flexibility, endurance in a gradual way, not in a sudden way. Then manual therapy, that mainly include trigger point release, MFR, transverse friction massage, etc. Then Mulligan lateral glide, it is also effective in treating this tennis elbow condition to reducing pain. The next one is taping. Taping, that you can see in this picture, that is how the taping, how this taping is done in the tennis elbow condition, okay. Then next one is there, it is the some exercise, that is what are the exercise, which are the exercise that is used in tennis elbow condition, that is mainly wrist range of motion exercise, wrist stretch, then pronation supination, end range of motion, wrist flexion exercise, then wrist radial deviation strengthening, forearm pronation, etc. And here the next picture, that we can see the eccentric exercise that should be done for 10 reps for 3 sets, then forearm flexor stretch, forearm pronation, extensor stretch, ball skis, skews, biceps curls, tricep stretch, then hammer curls, etc. So these are the main exercise that can be given for this tennis elbow relief. So what are the physiotherapy technique that should be following a surgery? So we have to take the measures to reduce the pain and inflammation, that is mainly by ultrasound or IFT or TENS, and we have to elevate the limb, and we have to start speedy as well as sustained active movements to the joints free of immobilization, and we have to start with slow relaxed full range of motion passive movements to elbow, forearm and wrist. Then shoulder girdle also should be mobilized to avoid adhesive capsulitis, and we have to begin with gradual active assisted exercise and should be progressed to self resistive exercise. Functional movement should be done, that should be carefully done, avoiding repeated supination, wrist extension and strong grip. Then we have to progress gradually to the progressive resisted exercise, okay. Then preventive management. So what are the things that we have to prevent? It is mainly we have to prevent the repeated forceful jerky movements to the common, repeated forceful jerky movement should be avoided, and activities like wringing, washing clothes and using a wrench, like that all should be avoided. Then mechanical professions and the sports athletes should be avoid some. I think that involve repetition of this movement can be get more chance to get this condition. So similarly we have to avoid that repeated supination, and heavy rackets or weight should be discouraged. Then proper conditioning and specific regimen of strengthening exercise of extensor carpi radialis longus and brevis should be done, and generalized strengthening also should be done. So this is the end of the slide. So if having any doubt, let me know in my comment box. Thank you.